Hey, do you think you might have a possible rotator cuff tear? Have you been told that you have a torn rotator cuff and you've got problems in your shoulder? You can't reach very far, especially going behind your back or all the way up overhead. Are you having trouble sleeping on that side because it's been hurting you at night? If you're looking for help with a rotator cuff tear, I'm here to tell you the 3 worst exercises that you can do for a possible rotator cuff tear, and then I'm going to give you the 3 best exercises that you can do for a possible rotator cuff tear. My name is Dr. David. I'm a physical therapist at El Paso Manual Physical Therapy. I've got Lily here, another physical therapist, and we're going to cover the 3 worst and 3 best exercises that you can do for a rotator cuff tear. Let's start with the first worst exercise. This is a very commonly found exercise on the internet. It's often done at physical therapy clinics. Sometimes other medical professionals will give you this exercise, and this shouldn't be given out willy-nilly. This exercise really is challenging for most people that have a rotator cuff tear, and long term it can make it worse. It might feel good during the exercise to do this, but if you keep doing this over time, it tends to further tear a rotator cuff. So the way this looks is, if you can get in position, you'll use a rubber band, or they're also called TheraBands. You might be holding the rubber band in your hand here, or they'll attach a handle to it, and then the rubber band's attached to a doorknob or a post or something sturdy, and then you'll be instructed to turn this way, and you're pulling out. And the idea here is to strengthen, go ahead and keep going, the rotator cuff muscles. And it's a little deceiving because you'll feel muscles burning up in the shoulder, and so it feels like you're getting work done, but it may not be helping out your torn rotator cuff in the long term. And they'll have you go the other way too. They'll change the attachment of the band from here to out here, and then you'll be instructed to pull in and go all the way out. And it can really be burning and achy if you're doing this exercise, and long term it can make the tear worse. The second most commonly done worst exercise for a rotator cuff tear is rows. Same thing, they'll use a TheraBand a lot of times on these videos online or at a typical physical therapy clinic, and you'll have 2 handles. Go ahead and demonstrate this, and you'll pull back, and you'll be instructed, or you'll be shown in a video, to pinch your shoulder blades together. Sometimes they use a cable pulley machine or some sort of rope system so they don't have bands. But the motion is the same, and you're using the same muscles, and typically you'll feel the muscles between your shoulder blades working real hard and getting warm and worked out. That muscle group right there tends to tip the shoulder blades down and pinch the rotator cuff worse. So that can, in the long term, make a rotator cuff tear worse. The third worst thing that you could do for your shoulder is a wall stretch, or sometimes called a doorway stretch. And I can't quite move the camera to show you just right, but I'm gonna be the wall for Lily so that you can see on Lily what this looks like. You might have found this on the internet or have been given this from a doctor to help out a rotator cuff problem. But they'll tell you to lean your hand up against the wall and then press into the wall and lean your body forward to create a stretch to the front of the shoulder, the chest. Sometimes it goes all the way down to the hand. The doorway stretch is very similar. You're putting both arms out. Go ahead and do that, Lily. And then your arms are on the edges of the doorway, and then you lean your body through the doorway to create a stretch on the front of the shoulders and the chest area. The reason this is such a bad exercise is because you're tending to move the ball and socket of your shoulder joint in a direction that further tensions the rotator cuff. And what you'll feel if you do this exercise is a big stretch, but it's not always the best stretch for you. It's rarely ever the best stretch for you, but the feedback that you're getting is, I'm stretching something, so I must be doing something good, but it doesn't feel good when your shoulder's hurting more at night after you've been doing this for a while. Let me tell you the top 3 exercises that I would start you out with if you've got an active rotator cuff tear or a possible rotator cuff tear. Here in the clinic, we coach people up on just getting the pain under control. One of the first exercises we use to do that is something called a windshield wiper exercise. So you can lie down on your side here. You'll do this in bed or on the floor, on a couch that's big enough. You'll need some space for your arm. Grab a pillow, and you're gonna put your arm up, shoulder at about 90 degrees, elbow at about 90 degrees. This makes it comfortable because if you don't have a pillow, your shoulder might start to shoot forward, and once you get into the motion, it won't feel so good. So the pill is a good idea to start with. Then what you're gonna do is very gently let your hand and arm move in this direction. Stop if it starts to hurt or if you can't go any further. Don't force it. You're just kind of letting it gradually fall, and then go the other way. You're going to turn this direction, and same idea here. Stop if you run into any pain or discomfort, or if that's all you got. And you're just going to go back and forth, easy, at about this pace. Keep going there. For 2 minutes. This needs to be done frequently if you have a really bad rotator cuff problem right now. I would do this every 1 to 2 hours, 2 minutes at a time, and just take your time with moving real nice and controlled. This gets the ball of your shoulder joint to sit in the socket better, and it very gently activates the rotator cuff muscles so that it doesn't aggravate a possible tear that you've gotten there. It should feel after 2 minutes like your shoulders just warmed up and like you can move a little easier afterwards. Let's cover the second exercise, Lily. So for the second exercise, we have people get up on their hands and knees. You can do this on the floor or on your bed. And the point of this exercise, it's a little counterintuitive. It's not what you think. You're going to be putting some weight through the shoulders. And let's say this is the involved shoulder. You got a rotator cuff tear on this side, or you think you might have one. Putting weight through it might not feel the greatest at the beginning of doing this, but once you follow the steps, it tends to feel better. So what you've got to do is push this part of your back up towards the ceiling like an angry cat, and that aligns your shoulder joint much better. Now, if you've got a really sensitive shoulder, then it would be a good idea to lean away. So put like 70 or 80% of your weight through your other hand and offload the affected side, because what you got to do next is make that shoulder joint move in a very controlled way. So holding this up, start to rock back and sit back while still maintaining this. Then come back up, right up over your hands, and then relax the back for a second, and then start over again. This allows for controlled, proper movement through the ball and socket joint so that rotator cuff, the muscles of the rotator cuff can learn how to operate normally again, and make sure that any sort of tears that might be in there are in a better position to heal. The next exercise that I recommend for somebody with a torn rotator cuff is something called shrugs. So let's have you lie down here on your back, leave some space up here at the top. And shrugs, the shrugging muscles are very commonly weak in somebody who's got a rotator cuff tear. And so beginning to activate them and getting them strong over the long term is, in 8 out of 10 people, a big deal. So here's how this exercise looks. You're gonna put your fingertips right by your ears on the bed or the floor, wherever you're lying down. Bring the elbows up gently, not directly forward, but just like Lily's doing here, just kind of comfortable at an angle is fine. Then what you're gonna do is slide your fingers up along the bed or floor, wherever you're at. And as you're doing that, shrug as hard as you can without any discomfort, and then come right back down and unshrug, relax the shoulders. And you're going up every time as much as your shoulder will allow you without getting any worse. And what you should find after doing this is that your shoulders will come up better and better with each subsequent rep. Do this for about a minute or two. Take your time, and it shouldn't be super aggressive. It shouldn't feel like you're sweating doing this. It should feel gentle and warming on your shoulders. And just like Lily's got her fingers bent like that, that's totally fine. Some people will drag their fingertips. It shouldn't hurt your fingers or anything else. And it shouldn't bother your neck. If it's bothering your neck, there's a high likelihood that your rotator cuff problem might be related to your neck. So you can take a break there, Lily. Those are the top 3 worst exercises and the top 3 best exercises to do if you've got a possible rotator cuff tear. Now, if you are looking for help for your rotator cuff tear, I strongly suggest that you go talk to a specialist about this. Somebody like me who's a manual therapist who's got tons of experience in dealing with rotator cuff tears is the type of person that you want to see to make sure that you address this type of problem without surgery, without having to rely on pain medications to sleep at night and get through your day, and without having to get injections every couple of months to get rid of the pain. It is very possible in about 9 out of 10 cases to completely avoid a surgery even if you've got a legitimate tear on an MRI. If you get the right muscles stronger, the joint operating better, pressure off nerves, the neck operating better, it's usually a multifaceted case whenever we see a bad rotator cuff tear, and everything has to be addressed properly in order to get that person into a position where their tendon heals, they no longer have a tear, and they're back to life as normal, able to use their arm for everything they want to do and sleep on it at night without ever having a surgery. If you're looking for more help on a neck and shoulder problem, I invite you to download our free guide on 10 ways to end stiff, achy neck and shoulder pain. Most of the time, whenever the shoulder is involved, there's also a neck problem. And this guide covers ways that you can begin to address it at home. I hope that we can be a part of your success story in avoiding injections, surgery, and medications for your possible rotator cuff tear. I hope that you get better sleep at night and can use your shoulder for everything that you need to in life. Have the best day. Bye-bye.